Good evening and welcome back to blackdoctor.org. I am your host, Dr. Renee, and I know you're used to seeing me on Thursday nights, but today is a special day. Today is HIV Vaccine Awareness Day, May 18th. So today we are going to have a really great discussion to help you understand, because everyone's like, HIV vaccine? I didn't know there was a vaccine. I know you're saying that, but you're going to learn a whole lot tonight about the HIV vaccine. But I need you to please share this broadcast. So share it in whatever platform you're watching on. Please make sure you share the broadcast, because I guarantee in 2022, you know somebody that is HIV positive or somebody that knows somebody. So please make sure. And plus, why wouldn't we all want to get the vaccine? We'll talk about that too, because there's been a lot of talk about vaccines recently. So please make sure you share the broadcast. Everyone, please share to your platforms. And I want to make sure that I thank our collaborating partner, the National Council of Negro Women. Thank you so much. And of course, along with the HTVN, which we will learn more about shortly. So my guests tonight are Dr. Bambi Gaddist. Thank you so much for joining us, Dr. Bambi.
Good evening.
And Dr. Ulysses Burley. Thank you for joining us.
Thank you for having me.
So let's start, Dr. Burley, by explaining what exactly is the HVTN initiative.
Sure. So the HVTN stands for HIV Vaccine Trials Network, which is the largest publicly funded multidisciplinary international collaboration for the discovery and evaluation of preventative HIV and AIDS vaccines. The HVTN Faith Initiative, of which myself and Dr. Gaddist are a part of, is an intentional outreach to Black and Brown faith communities around education and information as it relates to HIV and AIDS, as well as COVID-19.
Thank you so much. So I want to make sure that everyone understands there's a trial. They are trying to create a vaccine. So it's soon to come, not here yet, but they're trying to create one. But today we're talking about this amazing initiative with our faith leaders, which is so important. And if we didn't learn anything in COVID, I think we learned that. So how does the work you all do connect to the HVTN initiative? Dr. Gaddis?
Well, I've been fortunate, I'm going to say, as long as we've been fighting this pandemic of COVID, to be involved and invited to work with what was the COVIPN, the COVID-19 Prevention Network, now the HVTN Trials Network. And I'm grateful that we've expanded the focus to include, because much of the lessons that we learned to come up with the vaccine for COVID-19 was critically related to the work that's been going on for almost 42 years with HIV. And so I am one of 8 faith ambassadors, and I have a core of committed individuals working with me in South Carolina and around the country to address this issue, to make sure that we ensure that research-based information, science-based information, and discourage really the perpetuation of disinformation.
Right. Definitely. And I, obviously, like I said, something else we learned in the pandemic, there is a lot of bad information out there that is just completely useless and can be very harmful. We learned that too. So it's so important that we get factual information. So Dr. Burley is a medical doctor. And so it makes sense that you're a part of this, because that one thing that, people come to Black Doctor for is the fact that we have people who actually understand the science and know what they're talking about to let us know, I'm not telling anyone that you should go get this vaccine, but I'm going to give you the information so you can make an informed decision. And so, Dr. Burley, how important is it for the faith leaders to be intimately connected to the work around COVID and HIV prevention?
Yeah, it's critically important. We learned during COVID-19 that we could create a vaccine that was 95% efficacious in clinical trials, But if the people who would benefit from them the most didn't trust the vaccine and wouldn't participate in the vaccine, then it was essentially science on the shelf. And so we quickly learned that we needed to engage those individuals in communities who have the trust and the community equity with the folks who we wanted to reach. And faith leaders still hold and possess a tremendous amount of trust in local communities, especially in Black and Brown communities. And so much of what we saw during COVID-19 in terms of the ability to create access in very short order for a novel vaccine was the function of community leaders playing a huge role in this. I mean, we saw churches become vaccine distribution centers, right? Like
Yep.
overnight. And if you live in a community like you and I live in, Dr. Renee, on the south side of Chicago,
Exactly.
there are more churches than there are healthcare facilities.
This is true.
And so it only made sense, right, then that churches would become a place where people could go and access what they needed from a trusted location, from a trusted leader. And so faith and faith leaders are critically important in our work that we continue to do with COVID-19 and our work that we are moving forward with HIV as well.
So please, if you're watching, tag your leader of your church or your, of your diocese, of your religion, of your, congregation, whatever their title is, tag them so that they can find out this information and perhaps they can get involved. Also, I want to make sure you guys notice there is a QR code on the screen. That QR code takes you to a survey. This is not signing you up for anything, but it's a survey. They're trying to collect information. So you want to talk about more about what information you're trying to collect?
Certainly. So, we want to get an understanding of where people are as it relates to COVID-19, HIV, and their faith, and how those things intersect in people's lives. And so, essentially, the survey is 10 quick questions that ask about people's knowledge around HIV in the United States, their knowledge around COVID-19 in the United States, whether or not they understand the difference between HIV and COVID-19, right? But also questions like, do you identify with the faith? How does faith play a role in the decisions that you make about your health and your wellness? And so these types of questions help us to better understand what we're up against, but it also helps to paint the picture just as to how much faith does play a role in science, in medicine, and how people interact with those industries.
Yeah, and it's important, always important whenever you're doing something like this to gather data so that you can get funding to continue your work. So we please, everyone, use the QR code. I also have the link as well. I'll put the link as a ticker. I'll throw that up there as well, just so you guys can see that as well. freeonlinesurveys.com/s/HBTN faith survey. So please fill out the survey. And if you want to give your information, you are more than welcome to do that as well. But you do not have to fill out your information. You do not even have to complete the entire survey. You can answer the questions you feel comfortable with. So please make sure that you check out the survey and give the answer as much as you can, because this is important. So we want to make sure that we always get left behind. So we want to not get left behind, and we want to be in front of this. So how have the responses been from different faith leaders to the mission of HBTN, Dr. Bambi?
It's been mixed.
Okay.
And it's to be realistic, it's been mixed. I think to Dr. Burley's point, I think one of the other key objectives that we've attempted and continue to address is the issue of stigma. And stigma is still very much alive and well. We know that it is still a critical issue in HIV and how people see people living with HIV. But we also were able to validate that it still permeates into this conversation around COVID. And so so let me just put on the record, I am not a medical physician. My work for the last, we won't get into it, has been in public health. And so I see myself as a behavioralist, and what I seek to do with clergy, faith leaders, lay leaders, and the community at large is really get into a honest, truthful conversation about what do they believe about HIV and COVID? What are their because their attitude is somewhat reflective of what they believe. And we know that attitudes and beliefs predict behavior. So, and what they say to their congregations, whether they are advocates or promoters, not again to his point, not to, or to your point, not to try to coerce or to shame people into vaccinations, but to just make sure that they have the information that's correct and steeped in truth.
Correct. Yeah.
In truth of science. And so as it relates to clergy, I've experienced totally motivated clergy who are ready, willing, and able, like the Marines, to get about educating, opening up their churches for vaccine sites and the like. Similarly, I've seen hesitancy within the clergy population, male and female, and but the truth is, we see some of that with physicians. We still have yet to totally encourage even physicians who have their own set of attitudes and beliefs about COVID to now move in a space where they advocate to their patients to do it. And so we see this work is ongoing. We see it as something that really never stops. That as long as NIH, as long as Fred Hutch Cancer Research Center, as long as those entities that believe that this is critical, deem it important to move this agenda, we're always going to be about doing the work. And we know that because we're 42 years into HIV and we still have challenges we're trying to overcome.
Yeah. It's crazy, 42 years. Wow. But hopefully we can.
And I've been there for all of them.
Well, look, I have too. But
you don't look it, but
thank you. Thank you, Mom. But I think that it's really crazy that it has been 42 years and that it's still not gone. When we know how to prevent it. But thankfully, we do have better medications now with HIV, and so hopefully,
prevention. And that is the other piece that we're here for. We're here to say that you can prevent HIV if you want it.
Right.
In brief, I was in a group of political leaders and community folks today on behalf of HVTN. 70 some people in a room of all different spaces in life. And when I asked them to raise their hand I asked them, did they know about the other blue pill, which was Truvada? And of course they laughed. I said, we have other things. Raise your hand if you knew about it. But then I said, no, raise your hand if you didn't know about pre-exposure prophylaxis. And more people raised their hand that they didn't know than those that said they knew. That there tells us we have much work to do with all the new innovations that are out with injectables and all of the new prevention and treatment regimens that are out. We have got to continue our mission.
Definitely. I totally agree. So, Dr. Burley, with there still being an array of perspectives and views on COVID vaccinations, what are the facts about the current status on COVID?
Right. Well, the current status on COVID is that COVID is still very much so with us. If you have been paying attention, there is a surge happening currently in our country. The truth is also that vaccines won't protect us indefinitely. And that's the reason why we have had to have several boosters since receiving the initial vaccine doses. And we likely will continue to have to have additional vaccine doses to protect us. We have data from the CDC that during this last surge, which really happened from December through about March, that 42% of people who died from COVID-19 were people who were fully vaccinated. Now, to be clear, they were also people who were overwhelmingly over the age of 65. And we now know that age is the number one risk factor for severe COVID-19 disease. But it's to say that even when 100% protected, we're putting too much pressure on the vaccines to keep us safe.
Right.
Without also continuing to wear masks, continuing to social distance, continuing to wash our hands, and things of that nature. And so, everybody got vaccinated. And to be clear, we still have, 100 million folks in our country who have not been vaccinated. But we took it as an invitation to immediately return back to our normal way of life. And that's not what vaccines are designed to do. They're not designed to 100% keep us safe from diseases without some other preventative measures. And so we're seeing the consequences of our rush to reopen, if you will, while not continuing to do very simple things like wear a mask. In that, people who are fully vaccinated, mostly our seniors, are still being vulnerable to COVID-19 infection. And the truth is, we'll likely see an even more significant surge once the winter months come around. And so, want to be clear that COVID-19 is not over. We don't really know what the future of COVID-19 will look like, whether or not we will have to continue to receive an annual shot like we do for the flu, or if it's something that has to be more frequent. But the science and the discovery definitely continues. And as time progresses, we learn more about this novel SARS-CoV-2 virus and how it impacts us. But my greatest advice would be for us not to drop our entire guard,
right,
just because we have vaccines now. I travel a lot for work. I'm traveling right now, and getting on an airplane, I still got my mask fully on the entire flight. Exactly. So, those are things that don't inconvenience me, but keep me safe, right? And those are things that we can continue to implore, such that we protect, maybe not ourselves because we're not as vulnerable, but we protect
other people.
Our seniors who we love, whose immune systems, even with vaccination, can't stave off a COVID-19 infection.
I think part of our biggest challenge as we do this work is familiarity. So when we're on a plane with strangers, I think it's much more easy to adapt to the mindset of social distancing, if that's possible, and certainly wearing a mask. It's when we're with friends.
Like upcoming Memorial Day weekend and Mother's Day and Easter.
And all of these, and Juneteenth, if you want to throw that in.
4th of July is coming after,
events coming up, and people are very hesitant to tell a loved one, you can't come in because you don't have on a mask. And so we make these, we're lenient in what we're demanding, when in fact, it's usually someone we know that brings it to us. It's not that stranger. It's someone who we call husband, wife, grandchild, friend, and family.
Yeah.
And so that's harder to negotiate. And to make it specific to HIV, I mean, we see the same thing when we talk to groups about using protection or using PrEP. They say, well, I'm not a candidate for that because I'm married, or I'm not a candidate because they go to church, or I'm not a candidate because I have a wedding ring on. Well, what we try to help people understand is our wedding rings are not condoms.
Mm-hmm.
They do not protect us from infections like COVID and HIV, and that we can only have a realistic conversation, not to force them or to harass them, but really to say, let's talk for real about what our real risks are, both with strangers and with family.
Definitely. So, with both COVID and HIV being so politicized these days, how are the public to know the truth and the reality of what to do to be safe and stay healthy for either of these epidemics?
Talk to Dr. Burley.
Yeah, I think trusted messengers like myself, like Dr. Gaddis, like you, Dr. Renee, become critically important during these times where everybody has a microphone,
Mm.
everybody has a platform, as a function of social media. And the loudest voices are usually the folks who barely got out of high school biology, right? And so,
Call that the
we
medical
have to,
degree from the streets.
right. So we have to vet the source, and from the source, then we can be more confident about the information. But we also understand, and we learned this. Dr. Gaddis can um, uh, agree that we learned this with our COVID work, that even with the right message, if it doesn't come from the right messenger, then it doesn't really matter what the message is. And so, again, making sure that we have people who are culturally competent with the communities that they are interacting with, that they have that trust, like faith leaders, and that um, when they're trusting those people are folks who don't have the information, that those people have the wherewithal to identify the folks who do, to be able to create that avenue of information and education exchange. And so, yeah, it's really about trust. That's why the HBTN Faith Initiative is comprised entirely of ambassadors of color who are professionals both in HIV and AIDS advocacy, but also in their faith spaces. And they are folks who are grassroots activists and advocates in their own right. And that combination has made us very successful in our outreach of, communicating the same information that, other doctors and professionals and advocates have, but who don't necessarily have that community relationship, that community capital that we have for that information to be able to be received in a positive way.
Well,
Yeah. Go ahead.
No, I was just going to say I've changed, compared to the first opportunities where we were providing services to the public. I kind of changed my motif, if you will, this time around. Some of the consultants, faith consultants that work with me, they're not all clergy. I do have a bright and proactive advocate, a minister, Reverend Adams, who serves LGBTQ plus community, and so that's slightly different. And because we expanded to HIV, it was important also to make sure that we were balancing out our conversations on these two issues. But I also have a gentleman, Mr. Chavis from North Carolina, who's very much has social capital within the Black male community, in the couples community. And so even tomorrow, we're doing a educational piece that's being hosted by he and a couple who do marriage counseling. Because the realities are, we're not just talking about HIV, how you get it, how you don't, how you get COVID, how you don't. We're talking about what's been the impact of these things on people's lives, and how have they. We talk about mental health. Is it Mental Health Month?
Yes. Mental Health Awareness Month.
And people have been depressed. they're coming out of this thing. They want to come out of it, but some of them are struggling. And so marriages are struggling, relationships are struggling, parenting is struggling. And so he is also interested in Black parenting. And so it's been through this avenue that we can really get into some really great conversations in real time about what people are doing to struggle through these two things.
And you know, we didn't even cover this in the beginning. What faiths is the HBTN Faith Initiative focusing on? Is it just Christian faiths or?
No, it's absolutely all faiths. It's faiths representative of the diversity of the United States, and so we have equal parts Christian, equal parts Muslim representatives, but we also have
Mormon.
We also have Buddhist and Baha'i faith represented, and even among these various faiths, each of our ambassadors has outreach and relationship with other faiths, right? And so some of the indigenous faith and belief systems. And so we've done a very good job of making sure that we are diverse in gender, that we are diverse across the beautiful diversity of Blackness and brownness, that we are diverse in faith and geography, but also that we are diverse in sexual identity and HIV status, right?
Mm-hmm.
And so we are really representative of what our country actually looks like, and that has benefited us in terms of our outreach.
So, what is the impact to the response, or some would say the lack of response to COVID, had on how folks are responding to HIV testing? Because there's a lot of people holed up in their houses.
Repeat that question again.
I said, what impact is the response, or some would say the lack of response to COVID, had on how folks are responding to HIV testing?
Well, I know for me, I've had our provider, they've approached me about incorporating HIV testing.
Okay.
That they were contracted with the health department to provide COVID testing, but from reaching out to these communities to do COVID testing, folks are asking, well, what about an HIV test? You got an HIV test while we're, over here? Let's just knock it all out in one hit. And so what they're doing now is trying to get with the health department to see how we can infuse HIV testing into our service delivery. And I think that's in a way that destigmatizes things. If we start looking, and I mean, the essential part is, I keep thinking about diabetes, Dr. Burley, and the impact COVID has had on people living with diabetes. And I know in South Carolina, we have some of the highest rates of amputeeism because of diabetes, with zip codes who are known nationally. And COVID has wreaked havoc on the diabetic community. And so those are also testing or diagnostic tests we look to offer while we provide COVID screening, because all of it's interrelated with predisposition and conditions that have led to folks early passing.
I want to
passing.
I want to affirm Dr. Gaddis's comments to say that people have never been more health conscious than they are right now because of COVID-19. Likewise, they've never been more aware of viruses and pandemics and vaccines
and
clinical trials than they are right now. So we see that as an opportunity to re-engage the community around HIV and AIDS conversations, to use that awareness to get us back on track with ending the HIV epidemic and as a public health crisis in our lifetime.
Yeah, because people think it's gone.
Right.
They're saying to us, "Oh, that's still a problem. I thought you all had that handled." And I'm like, no, we're far from handling it. And one of the critical things that really came home today in this rural community was when they really saw the data that said that their small county compared to other larger metropolitan statistical areas was ranked in the top 5. And they said, well, how could we be in this rural community? And this city over here, when we look at our rates per 100,000, we're larger than them. It's because you're in a smaller community. It's easier to spread it.
Exactly. Yeah.
And so we're not done. It's time, what I said to them, it's time to rekindle the fire. We need to rekindle the conversations that we used to have before we thought it was all over.
Yeah, I was just going to ask you, how is it, what are you seeing happening in the Deep South around COVID, both on the testing front and vaccination front? But you just said, that they are testing, but, it's still COVID's a problem, HIV is a problem.
And they're struggling with boosters. We got them through. We were able to be pretty successful, and the data shows that we've been more successful in getting folks to get the 2 shots.
Gotcha.
Which is the baseline minimum.
Right.
But it's when we start talking to them about getting a booster, and now we're in a
fourth
booster, they're like, nah, I'm not doing that. But yet we know with Omicron variants, and what Dr. Burley has already indicated is that there's periods of effectiveness or efficacy, and it wears out.
Yeah. Yeah, and only lasts in your system for so long.
Well, how many more boosters am I going to have to get? Now, personally, I say I don't care how many boosters I have to get, as many as it requires. But that's me.
Right. But it's funny, before this happened, people went and got flu shots every year. Now, granted, there were a large amount of people that did not, but there were a lot of people that did. The drugstores had flu shots. You'd go to your doctor, you'd ask for a flu shot. People in certain populations, they understood they had to get their flu shot. Pregnant women got flu shots.
I mean, even not flu. I mean, we all had to be vaccinated just
right. Exactly. And you know what people don't realize is that those vaccines we had to go to school, you're supposed to go get boosters. A lot of people haven't done it, but I know Dr. Burley, when we went to med school, we had to have updated all of those things. So everything, MMR, TB, all of that stuff.
All of it.
We had to have again as adults to go to med school, because we were going to be working in the hospital.
Well, I didn't. And I'm probably more specific to the mainstream population.
Right.
I will admit it, because I believe in walking in truth. Up until COVID, I never had a flu shot. I never had the flu, and I never took a flu shot. But once COVID came in, I said,
all the protection you could take.
I got my first flu shot, and I'm proud of a badge-wearing flu shot member. And now that I've taken that leap, I probably will do it again. But I'm honest enough to say I had not. And I think there's other folks out there like me.
Right.
And that's,
go ahead.
That's a trend that we saw throughout COVID-19 in our communities, where initially people would say, I'm not quite sold on this new COVID-19 vaccine that came kind of fast, but for the first time in my life, I'm going to consider and take a flu vaccine, because I don't want to end up with flu and COVID. But also, if I do get sick, I don't want to have to figure out whether it's flu or COVID, because you might be playing some roulette there.
Get out of my head.
And so then you had other people who would gradually go get flu shots, and then after a while they would participate in the COVID-19 vaccine. And as a result of all of the COVID preventative measures, people going to go get flu shots like they never did before, we essentially eradicated flu in our country during the years of the heightened pandemic. And nobody talks enough about that, how we averaged at least 30 30 million deaths a year around flu. Whereas we barely had, 30,000, I'm sorry, not 30 million, but we barely had 2,000 cases of flu in our country during 2020 and 2021. And, a big part of it is because of masks, because of washing our hands,
Right,
but also
exactly.
because people in mass participated in flu vaccines, possibly as an alternative to the COVID-19 vaccine, but then would eventually participate in the COVID-19 vaccine.
Can you speak to the perpetual question of why a vaccine for COVID could be created so quickly, but we haven't been as successful around HIV vaccine?
Oh, sure, that's easy.
Right.
First and foremost, just because we don't see it doesn't mean scientists aren't working on it, right? And so the technology that gave us quick and effective COVID-19 vaccines is technology that people have been working on for more than 20 years. That's first and foremost. Second is, to Dr. Gaddis's point, we've been in HIV for more than 40 years, and that science had played a significant role in why we were able to achieve a COVID-19 vaccine so quickly. The other thing is that HIV and COVID-19 are significantly different viruses. And, not to get too technical, they're not created equal. But then the mRNA vaccine platform really revolutionized the way and the speed for which we could take a genetic sequence, create it in a lab, get it into a vector, to get it into an animal, to then get it into people. And all of that happened within like a 3-month time span.
And with Black leadership.
Right.
Yeah, Black leadership, and then finally funding. So, one of the reasons why it takes years, decades sometimes even, to bring a novel vaccine to market is because it takes a lot of money. It's an expensive process. And a lot of times we're asking researchers not only to do the science, but also to do their own fundraising. And so all of that takes time. Because COVID-19 was emergent, because it was global, because it was impacting all of us, governments literally were writing blank checks to fund COVID-19 prevention research. And so scientists, for the first time in their careers, got to just focus on the science. They didn't have to worry about how it was going to get paid for, whether or not their grant was going to run out, whether or not they had enough resources and personnel to be able to get the work done. And so again, all of this has shown us what's possible when we properly resource scientific research, but also when we couple it with a resource community engagement strategy, and in our case, a community engagement strategy that includes faith communities.
Can you tell us, where are we headed in terms of a vaccine for HIV?
Sure. So to date, we do not have an effective HIV vaccine. Let me start there. We have been working on an effective HIV vaccine for decades. The progress that we made with COVID-19 vaccines, particularly the mRNA platform, has given us new life in terms of what could be possible for the HIV vaccine, such that currently there are 2 mRNA HIV vaccine trials that are active, one of which is being hosted by the HPTN. And so clinical trials exist. We've learned a lot, some of it through failure. And each opportunity has given us more information to improve on the previous model. And I'm optimistic that in our lifetime, we will have a semblance of an HIV vaccine candidate that prevents HIV and maybe controls HIV disease on some level. We've kind of got spoiled with vaccine efficacy, which is the how effective a vaccine is in a clinical trial, which is different from how effective a vaccine is in the general population. But we got spoiled with these COVID vaccines that were 95% efficacious in clinical trials, right? We're not going to see that with an HIV vaccine because of how different HIV and COVID-19 are. HIV being mutating much more quickly, being across a number of different strains globally. But people need to understand that even a marginally effective HIV vaccine, 35%, will prevent millions of new HIV infections and save millions of lives. And so that's what this is all about. Giving people choices to better protect themselves, to better improve their health outcomes. And an HIV vaccine would be a great choice in our prevention and treatment toolbox to add to antiretroviral therapies, which when people have access to, make people living with HIV just as healthy as people not living with HIV, or pre-exposure prophylaxis that Dr. Gaddist talked about. That one pill daily that people not living with HIV can take, and with 100% guarantee will prevent them from acquiring HIV. And so these are all tools that help us get to zero. And to date, we haven't eradicated a disease entirely without a cure or a vaccine. We have neither for HIV. And so we have to continue that work.
And just as a final note, I shy away in community with using the term failure, because I'm not sure it's a failure. I mean, we set hypotheses and we seek to support them or reject them. And so when we have a clinical trial and it does not yield what we were hoping it would yield, or it doesn't support the hypothesis we put out there, the fact is that was a lesson learned versus a failure. So we know what not to do, as much as we learn what we should do or do better. And so that's just the way life is. We walk through this life and we figure out what works and what doesn't. And what doesn't, we hope that we stop doing it, or we don't do it as much, or with the goal of eliminating something. But most people will say, even in their moments where they made a certain decision, a bad choice, or it didn't work the way they thought, they learned something from it. And that's what we're doing in science. We're learning. And for the record, we're not experimenting on people. We don't move agendas forward unless we have some sense of accuracy based on a lot of strategic and scientific study that something should go out. So when the COVID vaccine went out, when Dr. Burley talks about the level of efficiency it did in reducing acquisition, reducing severe illness, and reducing death, that was the end game. I keep seeing questions about race. I'd be very interested to know what Ulysses would respond to, because personally, I'm finding difficulty finding race data. I'm not sure if states are censoring race data, where we can go into a community and say, based on what we see, this is the incidence or the prevalence of COVID. We see it more in HIV, but I have not seen readily accessible data around COVID like I've seen with HIV. And I'm wondering, even in this platform, are you seeing that too, or is it my figment of my imagination?
No, that's an accurate assessment. So early in the COVID-19 pandemic, states were not required to report racial demographics. Whether or not that was intentional, I'll leave that up for folks to debate. But those of us who do this work knew exactly who COVID-19 was disproportionately impacting because of the social determinants of health, right? And so as we got deeper in the pandemic, we started to see more data as it relates to race and ethnicity and COVID-19 incidents, hospitalizations, and deaths. And we continue to receive that information, but it's incomplete. because again, we have some states who completely are just not reporting the data. Whether or not they're actually acquiring the data, we're not sure. But again, there's no mandate to say that um, when they sent their information to the CDC or these other entities, that it was stratified based on racial or ethnic data. Now, because of the landscape of our country, you can easily make assumptions, right, based on zip codes,
Yep.
based on counties. And so we know because of that information that disproportionately Black counties in the United States bear the overwhelming brunt of COVID-19 infection, hospitalization, and death in the heart of the pandemic. And that those areas were also areas where vaccine access and uptake did not match the incidence that was happening. And you see that across nursing homes and disproportionately Black and brown communities, um, and all of other manner of locations that were disproportionately impacted by COVID-19. And so, again, it's the conversation around health equity, right? And systems. And COVID-19 exposed a lot about our system, particularly our healthcare system and our public health infrastructure. And it speaks to why we see disproportionately impact of HIV and AIDS in Black and brown communities as well. It's not because Black and brown people are more susceptible genetically or biologically to disease, that our skin is pathological. It's because of social constructs that make us sick and keep us sick.
There is a report that came out recently through the Black Coalition Against COVID. The title is The State of Black America and COVID-19. It's a 2-year assessment. I think that's probably a document that folks might be interested in. It does look at things pretty holistically. Dr. Reed Tuckson, I believe, is sitting as chair of that body of individuals, and I would guess to say that he and his cohorts had definite access that some of us may not have.
Right.
So I think it's worth looking at just to see where we've been.
We've
Which
done
is-
several talks with them to, here on Black Doctor. And so I've worked with Dr. Tuckson quite a bit. So yeah, that would probably be a very good place to look. But I want to make sure that we address this. Can you please let the viewers know how can they get connected or engage with the HVTN Faith Initiative?
Yeah, certainly. So you can access the HVTN Faith Initiative via the HVTN's website, which is www.hvtn.org. And if you click on community, there'll be a drop-down list and you'll see where it says HVTN Faith Initiative. And that'll take you to our webpage where at the bottom, there is a link to contact us. And there is a link to participate in the survey, which you all have here in the ticker, as well as in the QR code. Also, today on HIV Vaccine Awareness Day, the HVTN has launched a new campaign called the Help in HIV campaign. And the campaign really is designed to refocus our attention on HIV in the United States, but even more specifically, the attention of young people, and to make learning about HIV and HIV clinical trials more accessible. And so the HVTN's helpinhiv.org website features the first of its kind national HIV registry. It's called the Red Ribbon Registry. And there, people can volunteer for these HIV studies that are happening here in the United States. The studies are happening across about 41 sites in the country. There are about 4 active HIV studies across these 41 sites. And most of the sites are concentrated in our urban epicenters where most people who are living with HIV or who are vulnerable to HIV rather would live. And so to be clear, the HIV vaccine trials are for people not living with HIV because the idea is prevention, right? You want to keep people without HIV, and it's never been more accessible as it is now. So those are two things, two ways where you can connect with both the HVTN, but specifically us, the HVTN Faith Initiative.
Awesome. So you hear the website's here on the screen. Also, the ticker is also going on the screen. And then, of course, the QR code. So please, everyone, make sure you please take the survey if you don't do anything else. And as he mentioned, very nicely and quietly kind of mentioned, if you would like to participate in the clinical trial, you can do that.
Yeah.
They would love to have you. You just need to inquire. But I think that we learned a whole lot in COVID, and we learned that we do have to be a part of the clinical trials so that these vaccines actually work on us. So,
As we did in diabetes and hypertension and
right.
all those other health disparities, all of them came through a clinical trial.
Yes. So, yeah, exactly. And so it's really important because we want to make sure that we are all taken care of. And if we don't get part of, if we're not part of the clinical trial, then there's a good chance that whatever vaccine they come up with will not work on us because we are not made like everyone, we're not all made the same. So that's why it's so important. So, as we are collaborating with the Sisters of the National Coalition of Negro Women, can you speak to the impact of COVID and HIV we are seeing among Black women? Somebody take that real quickly before we end.
Dr. Gaddis?
Well, I'll leave it simple. We're caregivers. We take care of everybody. And we can look at the numbers, but I'm sure that when our numbers are impacted, it impacts the entire unit of the family,
Mm-hmm.
children to their partners and the like. And so I think that one of the great things is that we are proactive for many reasons that we can't discuss today, but we look to women to continue their efforts to encourage their loved ones, to guide their children. And I will say, we haven't talked about it much, but we need our children to vaccinated as well. That there are effective vaccines out here that have been confirmed as effective for children, but we're still struggling to convince pregnant women
Mm-hmm.
that vaccines are efficacious, as well as making decisions about um, our children. And so we look to Black women, we look to women to continue to push the agenda about how we protect our families.
And then lastly, are there resources or tools that our faith leaders wanting to do more around HIV can connect with or access?
Sure. So again, the website
Okay.
and the Help End HIV .org website that was just launched has a
I'm
breadth
going to put
of.
that in the comments. Wait a minute. Hold on one second.
And if
Okay.
someone goes to the website, they'll see the ambassadors listed. And if we're in their community or they want to reach out, we'll be more than happy to reconnect.
Okay. Perfect. Help and HIV?
That's right. .org.
Got it. Okay.
Yeah.
Oh no, we lost him.
Oh, where'd he go?
Okay, I don't know. But we were pretty much done anyway, thank goodness.
Mhm.
But helpinhiv.org is the website he just mentioned, and I put that in the chat so you guys can see that. I will try and throw it out. Here he is.
Shout out to Amara Kennedy, too.
Yes. Thank you, Amara, for organizing this. And again, like I said, thank you to our partner, the National Coalition Negro Women, helpinhiv.org. Okay, I'm going to put that on the screen too now so you guys can see that as well. So please fill out the survey, visit the website. You might find some information you didn't know
Right.
and pass this information on to somebody. Make sure you share this, even if you're not, even if it's way, way later in life. Share, tomorrow, next week, share this broadcast with somebody, because I guarantee they do not know about this faith initiative, and they don't know that they are working on an HIV vaccine, because Lord knows in COVID we heard a million times, well, why isn't there, a vaccine for HIV? Well, they're working on it. And so here's the information. So please make sure you share this information. And any last words to my guests?
I know I appreciate you entertaining us this evening on this very important topic. So maybe this won't be the last. And can I take a picture?
Yes, ma'am. We can do it when we get done. Go
Okay.
ahead.
Yeah, I echo Dr. Gaddis' sentiments. Just really grateful that this field of science is being given a platform in our communities, but even more than that, science, when coupled with the sacred and understanding that our belief systems are as important as the actual physical aspects of our health and wellness, and that they need to be considered when making decisions about um, viruses and vaccines and otherwise, that all those things need to be a part of the conversation. So thanks again to you, Dr. Renee. Thanks to BlackDoctor.org. Thanks to the National Council of Negro Women. And thanks to the HIV Vaccine Trials Network.
Thank you so much. And everyone, have a great evening. I will see you tomorrow night. And we have another discussion about Asthma and Allergy Awareness Month. So see you then. Bye.